When you got up this morning, you probably brushed your teeth and there was fluoride in the water. If you drove to work, you wore seatbelts. The fact is that we have for a very long time had a early intervention and a prevention focus on our physical health. We've not had that around our mental health. And it's really clear that because we've not had that kind of emphasis on early intervention and preventing mental health challenges, we end up with a very crisis-oriented system where people don't get the help that they need until they're in crisis. Priority 6 is so important, early intervention and prevention, because it will help people get the help that they need much sooner. Early intervention and prevention have been a major need within the mental health community for a very long time. We can wait until people are in crisis and have a diagnosis, or we can begin intervening at the moment that we think people have a need. And if we want to have any shot at being able to deal with the coming curve of mental health issues as a result of this pandemic, we're going to have to intervene as early as we can. If, when we began implementing these early intervention and prevention strategies, if we saw fewer people going into crisis services or needing crisis services, fewer people going into the criminal justice or the juvenile justice system, you would see children who are doing much better in school. We know that one of the biggest predictors of children doing well in school is whether or not they have a social and emotional problem. So the first challenge that we have to deal with is giving people a different mental model of what it means to be a mental health professional, giving people a different mental model around how we intervene with people. It's not just after they have a diagnosis, but really using our expertise and the psychological literature to help identify strategies that people can employ before they get into having more significant problems. So we have some work to do. We have to change the mindset. We have to develop new skill sets, and we have to develop new interventions. And so it is really critical for us as a nation to get out ahead of this issue, to work upstream, to try to identify issues early, to equip people with skills that they can use to address their own mental health issues. If we're going to really be able to intervene early, we have to change public perceptions. That can only happen if people in the public sector who have responsibility for the safety net of mental health services are partnering with people in the private sector who may have connections to and resources for people in the general population. I've seen the power of people coming together around these issues and what that can do for a community. There are clearly some programs that can be employed, evidence-based programs that can be used to help prevent suicide, particularly in healthcare settings. But I also believe that we have to have strategies to give people hope and to identify people early on.